Hi everyone, welcome to my channel. This is Josie's Point of View, where we focus on human interest stories from the Carolinas and beyond. Today's Thursday and it's September the 23rd, 2021. Thank you so much for tuning in. If you're new to my channel, I'd like to extend to you a warm welcome. Thank you so much for stopping by. I hope you find the information on this channel to be informative. Here we do not cover gossip. We cover stories that have been published and verified through reputable sources. And if you're a returning viewer, by all means, thank you so much for coming back. You know, I always say the tide changes so frequently here on the YouTube streets, so you need to acknowledge where your support comes from. And I want to tell you that I sincerely thank you for your support. Feel free to like and to share this video, and don't forget to subscribe. Thank you. And our story today comes from Fayetteville here in North Carolina. Take a look at the headline. And it reads, Fayetteville VA Hospital gave expired vaccine to its veterans. I'll provide you with a summary here, and as always, I'll place links to a few of the full articles in the description box. And today we're talking about the Fayetteville VA Medical Center. As some of you already know, it's the largest healthcare facility for veterans in our region, and it provides services to a veteran population in excess of 80,000. And it's a place where I receive my healthcare, and I've done a few videos about the hospital in the past, and I try to be as objective as I possibly, because to be honest, with the exception of mental health, which is a big piece, I have received outstanding healthcare. But we won't be talking about mental health today. We'll save that for another video. Here on the YouTube streets, content creators often refer to exclusive stories or stories from inside sources as having had the tea. Well, I've had the tea on the story for about 3 weeks now, because some time ago, one of my subscribers brought this information to me and felt it needed to be publicized. But I could not find anything printed on it. I even contacted an inside source to verify the information, and that person said, I don't think you're correct. So I left it alone. I sat on it until now. It's finally being filtered out to the public, so I feel comfortable talking about it. I'll tell you what's been published first, then I'll share with you what my sources told me before finally telling you which version of it I believe. It was a few days ago when several of our local newspapers reported that the Fayetteville VA Hospital had acknowledged they had notified 281 of its patients that they had been administered an expired dose of the Pfizer brand COVID-19 vaccine. One source specifically stated 300 VA patients had received a Pfizer COVID-19 vaccine that had not been administered or stored as per manufacturer's recommendation. But the information was short, and it left the reader with many unanswered questions. Seems as if the VA had given out just enough information so people would stop talking or stop asking questions, but the whole story was not being told. Reports say the expired vaccines were administered to veterans, spouses, caregivers, and employees between the period June 23rd to August 19. The report also says the vaccines were considered expired because they were frozen up to 21 days longer than what was recommended for cold storage. The reports further states that the VA indicated they had been in contact with Pfizer scientists and was told the vaccine did not pose a known health risk, but that the full effectiveness of the vaccine may have been reduced as a result of the expiration. And after their discussion with Pfizer scientists, out of an abundance of caution, the VA is asking all of those patients to come back and get another dose of the vaccine just to make sure they are appropriately covered. Now, there was one newspaper source, I believe it was CBS 17. One of their reporters requested further clarification from the VA. They wanted to know exactly how did this all happen? How was it that, these VA patients happened to get expired COVID-19 vaccines? Did those administering the shot simply overlook the dates? And what's going to be done to make sure something like this does not happen in the future? All of these seem to be very good questions, but they did not receive a reply from the VA. So let me just lay things out before you for a few minutes. The VA said this problem happened during the period 23 June to 19 August. So that's over a 57-day period. A vial of the vaccine, of the COVID-19 vaccine, has a little over 5 doses, but they're saying for sure 5 doses. So if you had 300 patients, as the VA acknowledged, who received the expired drug, and that means only about 60 vials or so were affected. And to be honest, I'm not really sure I believe that. I'm not convinced that's the real picture. It's very possible that the message the VA wants the public to hear is that only a handful of these vaccines were affected in order to minimize a negative response from the public. And as I mentioned to you earlier, someone had contacted me about 3 weeks ago with this story, and I'll share here a portion of the information I received, and this is just a small portion, but in that message it says that VA recently realized they had given expired COVID-19 vaccine to employees and to what unofficially is being discussed at approximately 2,000 veterans. The VA now wants you to believe it's around 300 altogether, but this source is saying approximately 2,000 veterans. And who do I believe? I believe that source. I believe it's much more than the VA is willing to admit. I think the number 2,000 or more seems much more realistic for a major medical facility with a large staff and a large patient population who is trying to meet the demands of making sure people are administered, that they're getting this vaccine, and it's being done in a timely manner. Mistakes can happen. Yes, they do happen, but I don't believe it's 300. I do believe it's about 2,000 or maybe more. So the question now is whether I feel betrayed by the VA. Well, it all depends. Now, this was clearly an error, although it should never have happened. It was an error. And the key is that the facility was under a significant amount of pressure, just like everybody else. There was a sense of urgency to get staff and to get the veteran population vaccinated. I'm sure they were subjected to other major factors, such as poor staffing. They were all, they're always understaffed, and there was a short implementation date, and that may have played a role in this instance. And then again, this happened over a 57-day period, and that's why I'm saying it's more than 300. But please know I am not defending the VA, but I would be more disturbed if the information they released to the public was not accurate. Then I would definitely be feeling a sense of betrayal. A problem occurred, you acknowledged it, you notified those affected, and you took corrective measures to make sure it doesn't happen in the future. Ever since I can recall, there's always been that feeling of mistrust with the VA, and when information is being presented to veterans and to the public in general, and when it appears as if you're not giving us the full story, that simply does not improve that relationship. We know the VA never releases any information freely, so you were probably pushed to say something about these expired vaccines as the story became more public. But the information you release needs to be done in such a manner that we, the consumers, that we have a feeling of confidence in what you're saying and a sense that you're not hiding information from us. We don't want to have to wait 6 months from today when the results of your internal IG investigation is finally released, then to find out you were being less than honest. So the questions from CBS News 17 are still relevant today. You need to do a better job of telling us exactly what happened in this instance and then outline the steps you're taking to make sure it doesn't happen again. There are so many veterans out there who are still sitting on edge when it comes to taking this COVID-19 vaccine. And when something like this happens, it only serves to heighten their anxiety. So come forward, tell us the truth, and help us to move forward. And we're still waiting for your reply. And that's all I have for you right now. Feel free to leave me a comment below and let me know what you think about this video. And by all means, feel free to like it and to share it. And if you haven't done so already, I want to invite you to subscribe to my channel by clicking on that red subscribe button. It's on the bottom right-hand corner of your screen. And if you click on this notification bell right here, you'll be the first to know whenever a new video is uploaded. I thank you for watching, and I'll talk to you soon. Bye.